Every year, thousands of Ontarians are thrust into a new and unfamiliar role. This new role can be scary, confusing, and frustrating, and can leave caregivers feeling alone or filled with guilt. When caregivers have a better experience, everyone wins. That's why we worked hand in hand with caregivers from across Ontario to develop this video, The Caregiver Wish List, to help new caregivers feel a little bit less alone in their journey through the healthcare system, and to help give healthcare providers a better sense of what caregivers are going through, and how to help make them feel included as important members of the patient's circle of care. Getting admitted into the hospital can be tough for patients, and it can be tough for caregivers too.
I wish that I had gotten a package. I wish that they had told me all of these things. You can park here. We have a special waiting room. The operation will probably be 2 hours. You should wait there, and the doctor will talk to you afterwards, and then you could meet your husband in his room, which will be this.
When a patient arrives at the hospital, sometimes nervous and intimidated, their caregiver is often in the same boat. Recognizing this and treating these caregivers as partners in care is good for caregivers, patients, and healthcare providers. Adding critical information, such as the caregiver name, relationship to the patient, contact details, and maybe even a photo, would help caregivers feel included and valued.
I care for my son Gabriel. He was a premature baby, and at 20 months old he was diagnosed with quadriplegia, cerebral palsy. And my wish list is also to have someone who help us navigate the system, which is very complex.
My husband arrived by ambulance, and my son and I followed in the car. I wanted to know what they were doing to help him, what we should do to help him, who the key players were, and how I could be part of that system. Not just acknowledging me as a caregiver, allowing me to, considering me an integral part of that team.
This involves communication. Medical staff include patients and caregivers in discussions about goals and expectations. New information gets added to a booklet of crucial information for the caregiver. It also gives the opportunity to prepare caregivers for discharge. Does the caregiver have the capacity to meet the patient's needs at home? If not, what training is required?
So I had similar experiences during long hospital stays where I had to learn dressings, I had to learn how to care for a central line, whatever it was. But I had to be able to do those skills before I brought my son home so I could care for him. I haven't found that yet in the adult world.
My mom has dementia, and I felt like when I was there, I couldn't even leave to go to the bathroom. Like, I literally ran to the bathroom, like ran back and found her in the hallway, and I was like, okay, you're not that far from your bed.
And on discharge from a healthcare facility, caregivers told us about the importance of receiving a warm handoff. This is when medical staff review next steps, ensure caregiver training is done, and connect the caregiver and patient with support networks.
Last January, my son fractured his hip in a snow machine accident and had to be flown to Thunder Bay for surgery and then flown back to the hospital in Kenora. To have proper discharge planning, to have the steps laid out, like his appointments for physio and follow-up blood work should have been done, should have been set up for him, even if he didn't have a family doctor, you know?
Right. Do an analysis of the household, how you'll be able to move around the household, what things you'll need. Have some counseling for the person taking care of that sick person, and have this all done before they leave the hospital.
Caregivers often feel overwhelmed and most alone once the patient is sent home. At this stage, it's important for continued assessments of the patient's condition and the home care setting to see if caregiver training or resources are needed.
Especially in the beginning, it wasn't really like a break for us because we would be right there and like helping give the shower too, and like it was basically like, okay, now there's this other person and it's basically slower. So like we have one PSW where my sister and I just shower my mom, and then she comes in and feeds her breakfast because that's what works best.
We're so unintegrated, if that's a word, that I have to take photocopies of the discharge papers and mail them to my family physician.
An often overlooked stage of the caregiving journey is what happens when the caregiver technically stops caring for the patient. This can happen for a variety of reasons, including the patient's death or the patient's recovery.
So she's always on my mind when the phone rings, you know, is it the home, did something happen? I'm grieving, I'm waiting for her to die. I have all these emotions around that, and there just seems to be the sense that once they're in there, the family is done. There's nothing more for them, there's no more support, there's no more communication. So that sense that, well, they're cared for, so you're checked off the list. I'm still a caregiver.
Depending on the patient outcome, various resources can be offered to caregivers, including grief counseling, connection to support networks, or even skills training to re-enter the workforce.
I need someone to talk to, and obviously I couldn't talk to my husband. So I found that tremendously helpful.
I believe in support groups. I attend a support group. Now I go every week. It's so important to connect with other caregivers because we can really share, cry together, we laugh together, and it's been a lifesaver for me. Thanks.
Together, we can support patient care and improve outcomes for all. For more information about the Caregiver Wish List, visit changefoundation.ca.